老师，下午好。我们还是简单说一下注意事项啊。第一是我们不到这个中间过道拍照；第二是拍照的时候不开启闪光灯；第三是我们把手机调至静音状态，再看看有没有在静音状态，我们调到静音状态。另外呢，如果要是定着闹钟的话，我们取消一下。谢谢各位媒体老师的积极支持和配合。
各位媒体朋友，大家下午好，欢迎参加国务院联防联控机制举办的新闻发布会。今天我们请来了北京市卫生健康委党委书记、主任雷海潮先生，北京市疾控中心党委书记黄春先生，北京市新冠肺炎救治专家组成员、地坛医院院长李昂先生，德胜社区卫生服务中心主任韩铮铮女士，就北京市的疫情防控和医疗救治来回答媒体的提问。首先通报一下疫情情况。5月10日0时至24时，各省区市和新疆生产建设兵团报告新增确诊病例17例，其中10例为本土病例，分别为湖北5例、吉林3例、辽宁1例、黑龙江1例，7例为境外输入内蒙古病例，无新增死亡病例，无新增疑似病例。当日新增治愈出院病例24例。
From hospitals, 24. 678 close contacts were removed from medical observation. Severe cases were reduced by 4. On the front of imported cases, remaining confirmed imported cases 99, including 3 severe cases. Remaining probable imported cases 3. Cumulatively confirmed imported cases 1,619, cumulatively discharged and from hospitals 1,591. There was no death case among confirmed imported cases. As of 24 o'clock, May the 10th, according to reports from provinces, cities, and Xinjiang Production Construction Corp., remaining confirmed cases 141, including 9 severe cases. Cumulatively cured and discharged from hospitals 78,144. Cumulative deaths 4,633. Cumulatively reported confirmed cases 82,918. Remaining probable cases 3. Cumulatively traced close contacts 737,127. Close contacts that remained under medical observation 5,501. On the front of new asymptomatic infections, the number was 12. On the day, 6 were transferred to the category of confirmed cases, and on the day, 20 were removed from medical observation, including 4 imported asymptomatic infections. Asymptomatic infections that remained under medical observation 780, including 44 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,532, including 1,047 cases in the Hong Kong SAR, 45 cases in the Macau SAR, and 440 cases in the Taiwan region. On May the 10th, across the country, for 26 consecutive days, there was no new death. Remaining severe cases have been brought and to under 10 cases for the first time. Imported confirmed cases were reduced to less than 100 in the past 14 days in 7 provinces. New domestic cases, however, have been reported. Cases related to domestic cluster cases have been on the rise. We must identify infection sources, transmission pathway, do a good job in the quarantine and medical treatment, cut off the transmission. This has been the update on the pandemic. Now we'd like to take questions. Please ask questions on today's topic. Please identify yourself before you ask questions. The first question goes to the journalist on the fourth row on the left side. Thank you. With the Shenzhen News. Beijing is the capital of the country. Prevention and control has a close bearing on the entire situation of the country. What are the specific features of prevention and control in Beijing? I'd like to ask Director Li Haichao to take the question. I'd like to thank the journalist for your question. As we all know, Beijing is the capital of our country. It is the political and culture center of China, also a center of international exchanges and scientific innovation. From the lens of prevention and control, we in Beijing are faced with greater pressure for the prevention of domestic cases and also imported cases. Besides, Beijing is closely connected with all other cities of the country and is engaged in close collaboration and exchanges with the other countries. So in Beijing, we should keep unrelenting focus on the prevention and control. We must do a good job in uniting all sectors of society. We must guard against all possible risks on the whole spectrum. From January the 19th till today, we have been dividing the development and the involvement into several stages. First was until the 31st of January, during which there were imported cases from Wuhan and Hubei. The second stage was a stage where there had been the concurrent existence of imported cases and domestic cases. That was between the 1st and the 28th of February. The third stage featured imported cases. On 29th of February, there was the first imported case in Beijing from other countries. Therefore, the focus shifted from the prevention and control of domestic cases and the imported cases from other provinces to the prevention and control of imported cases from other countries. The third stage lasted until the 3rd of March. The fourth stage started on 31st of March till today, during which imported cases have been on continuous decline. Prevention and control focused on the dual tracks of prevention of domestic resurgence and imported cases. I'd like to share the following information with you first. If we look at the cases here, the majority part have been the imported cases. Up till now, we have identified and reported 593 COVID-19 cases, among which imported cases were 377, 64% of the total. The imported cases from other provinces were 199. Imported cases from other countries were 174 cases. This commensurates with the influence of Beijing in China and in the world. In review of the past few months, Beijing was among the earliest to report domestic cases that have been imported from Hubei. Beijing was also among the earliest to identify imported cases from other countries. This has been some of the pronounced features of prevention and control efforts in Beijing. On one hand, they have exemplified Beijing's close connection with other cities and other countries. On the other hand, it also shows the Beijing health system has been sensitive in identifying cases. We have been detecting the clues in the earliest time.
and conducted immediate reporting. In the early days of epidemic control, we have 104 fever clinics among the tertiary and the secondary hospitals. They are indeed sound sentinel points. So from the early days to the latter days, many of the cases were identified by the fever clinics. Then we are able to realize the early detection, early identification, and the early treatment, contributing to the anti-epidemic efforts in Beijing and also the improvement of the cure rate. In mid-January, we set up the expert team for COVID-19 treatment, and then in mid-February, we set up a dedicated expert group to treat the severe and critical cases. Dr. Li is also a member of the expert team of the COVID-19 treatment, and he's also engaged in the treatment of severe and critical cases. As you know, many of such cases were treated in Ditan Hospital and were cured by President Li and his colleagues, and also hospitals like You'an Hospital and the Fifth Center of the Army Hospital have also contributed greatly to the sound treatment of the cases. Reviewing the efforts, we can see that we were able to quickly identify and diagnose the COVID-19 cases. And this was because we had already trained the COVID-19 nucleic acid testing capacity in the early days. 17 of the CDC points or stations in the city have already been equipped with such capacity, and the tertiary hospitals were also equipped with the NAT. So we have quite many tertiary hospitals who were able to conduct the NAT. Secondly, I'd like to brief you that it takes a fairly long time for the municipality to treat the cases. We had the first case on January the 19th, and by April the 15th, we had the last case reported. Now, 25 days have passed, and there were still 16 severe cases treated in the Ditan Hospital. Many of them were overseas imported cases in March and April. So in general, we can say that in early days, we had the imported cases from Wuhan and Hubei, and also some indigenous cases, while in the latter part, we had the overseas importation, and we had such transition. Thirdly, we found a fairly large share of elderly patients, and also many of them have underlying conditions. In the latter part of January, it was coincidentally this year's Chinese Lunar New Year holiday, and there were a lot of family visits, and in Beijing there were also many elderly patients. Among the 593 confirmed cases, 118 cases were above 60 years old, and the average age is 70 years old. And also most of them have underlying conditions like the CVDs, high blood pressure, and some of them were even suffering from cancers. Previously, the hospitalization period for the COVID-19 patients were a dozen of days, but in the latter part of the epidemic control, the average hospitalization was 25 days. So we do find this a prominent feature. I'm sure Dr. Liang is going to elaborate on these features, and I'm sure you will be able to get more information. Firstly, Beijing has been conducting the joint prevention and control. Starting from January the 24th, Beijing had the level 1 response against the epidemic, and it was sustained until the end of April. We adjusted the level 1 response to level 2 response on April the 30th. The government, the military, and the whole society were working together. It is fair to say that the local government has made a lot of exploration. In particular, it has set up a mechanism to have synergy and coordination among the various parts of the society. I'm sure our friends from the media have already felt the detailed efforts by the neighborhood communities, and this is the result of the joint efforts by the volunteers, the residents, the community workers, and etc. It is their dedication and their efforts that our community-based activities were conducted in a sound manner. All the people who stay in Beijing can enjoy a stable and safe environment. And also in the latter part of February, for overseas importation, we set up a mechanism which is a joint mechanism to guard against the overseas importation. This mechanism has engaged many aspects of the society, including the transportation, the immigration authorities, and etc. All of us have contributed to the prevention and control efforts in the capital. Also, last but not least, I'd like to say that the municipality has also related itself to Wuhan, and following the national arrangement, some of the medical teams from the municipality went to Wuhan to offer help. It is fair to say that the leading experts and COVID-19 prevention and control capacity were also sent to Wuhan to offer our help in the battle against COVID-19. We still have a couple of experts who are now working in other parts of the country to fight against the COVID-19. Okay, let's continue. On the left, on the front row, the first reporter, please. Thank you. With CCTV, the finance channel, the Beijing CDC is a professional public health institution. It contributes to the decision-making and also the technical assistance. Please elaborate on the role of Beijing CDC. We will have Dr. Huang Chun to take your question. Thank you very much for your question. Indeed, the Beijing CDC is responsible mainly for epidemiological survey, the assessment and the tracing of close contacts, the laboratory testing, as well as health education and health promotion. Also, we have experts engaged in the risk analysis and assessment. The Beijing CDC have more than 80% of the people or staff engaged in the anti-epidemic efforts. Also,
We've trained 3,000 staff and epidemiologists across the country to be the standby and to assist when necessary on a daily basis. Domestic, international, and municipal pandemic situation has been brought under analysis. We put forward professional ideas and opinions to serve as the reference for government decision-making. In the initial stage, we already understood because we've experienced the 2009 H1N1 and 2003 SARS, from which we've drawn an important lesson. That was the catchment area and the departmental and organizational accountability system in place. In the initial stage, we already felt keenly the high possibility of transmissibility. So we suggested to the government the accountability system, and the government adopted our suggestion. In the early part of February, we've noticed that many people coming back from Wuhan during their home quarantine led to some family cluster cases. In light of such a situation, we suggested to the government that home stay quarantine should be changed to mass quarantine to curb and cut off the transmission in communities and families. In our epidemiological survey, we've also identified some other phenomena. For example, the transmission risk caused by the social dining. So we suggested to the local government for the forbidding of social gatherings and social dining. Such recommendations were adopted by the government and were welcomed by Beijing citizens. When the pandemic was rampaging across the world with the increase of imported cases, we've been analyzing the situation unfolding in different countries. We've also been screening over the imported cases. We've been adjusting the prevention and control strategies. We've also been recommending the mask wearing strategies, the precision prevention control measures, the NAT test capability improvement, and the prevention and control methods dedicated to the May Day holiday. On all these fronts, we've been providing government with the feed of our professional ideas. On behalf of the Beijing Disease Control Center, I'd also like to take the opportunity to thank the professional teams, experts' support, including the China CDC, the Concord University Hospital, Tsinghua University Hospital, and other institutions that have been engaged in our joint analysis for supporting the final decision-making. I'd also like to thank the journalist for putting forward that question. Next question goes to the journalist on the first row on the right side. With CCTV, we know that during the COVID-19 response, Beijing reused the Xiaotangshan Hospital. What was the consideration back then? What will be the plan in the near future? I'd like to ask Director Lei Haichao to take the question. Thank you for your question. Xiaotangshan Hospital might be simple. Everyone, upon hearing it, can associate it with the 17 years ago experience when we used it to fight SARS. It was also an embodiment of the collaboration between the civilian health services and the military services. It shows the solidarity, dedication among the Chinese people. 17 years later, in face of the unexpected COVID-19 outbreak, and on top of the joint analysis by different experts from all sectors, and under the great uncertainties, even though Beijing is blessed with rich medical supplies and resources, we have to prepare for the worst. So in the earliest time, we convened an emergency response discussion and was planning to start and reuse the Xiaotangshan Hospital on top of renovation. On 23rd of January, we reinitiated the renovation of Xiaotangshan Hospital. If any of our journalists have participated in the press conference release of Beijing municipal government, some of you may have the impression that at the end of January, I was asked the question what were the considerations for Xiaotangshan Hospital. My answer back then was that if a situation needs, we do not exclude the possibility of leveraging Xiaotangshan Hospital for the treatment of COVID-19 patients. Since March, the overall epidemic has been declining across the country. However, as I've mentioned previously, on 29th of February in Beijing, we found the first imported case from other countries, and on a daily basis, the inbound travelers through Beijing International Airport was as many as 5,000 to 8,000. International flights numbered 30 to 40. After the pandemic was raging across the world, some of the travelers have shown symptoms and had the history of exposure. After the screening by the customs, certain travelers have to go on further medical screening and observation. In the initial stage, we put them in Ditan Hospital. However, Ditan Hospital was shouldering with the responsibility of the treatment and also an enormous challenge of testing. As we all know, to diagnose COVID-19, we had to look at the CT images and NAT test results. These two most basic tests need time. So back then, Ditan Hospital was under great pressure because the inbound travelers screened by the customs and showed certain evidence for further screening had to go to Ditan Hospital, and they had to stay there for some while. Back then, at the end of February, early March, Beijing was still quite cold. Ditan Hospital had to provide them with the necessities to stay over. There were great difficulties. That's why on the 16th of March, we decided to restart the use of Xiaotangshan Hospital, which in the beginning was designed to convert infectious disease. It could conduct the clinic screening testing. It could also complete the tasks for treatment. Among the 21 hospitals affiliated to the city, we've taken out 1,000 plus health professionals to help Xiaotangshan Hospital on top of their existing staff. After its use on the 16th of March till today, on a single-day basis, the highest number for screening was even 400. These travelers need some waiting time to wait for the confirmation of testing results before they can embark on the next section of their travel. So back then, it was because of the close collaboration between Xiaotangshan Hospital and Ditan Hospital that we have overcome all the difficulties. Between 16th of March till 28th of April, the last patient was discharged from the hospital. The operation of Xiaotangshan Hospital lasted for 44 days, in which important mission has been accomplished. Some COVID-19 cases were identified. Some probable cases have also been found. On a cumulative basis, 1,700 have been screened. 54 confirmed cases were reported. 27 probable cases were reported. It's fair to say that in the past month and over, Despite the fact that Xiaotangshan Hospital was composed of health workers from different hospitals, but the health workers and professionals adapted really quickly and took up their responsibility, explored innovative ways of services. I'd like to mention in particular that we set up a TCM zone in which TCM was mainly used for the treatment.
This has also generated sound results. Now, in Xiaotangshan Hospital, all the patients have already found sound outcomes, and over the 1,000 medical professionals, there's zero infection. And also, for all the inbound travelers, all of them had been tested. Xiaotangshan Hospital was established in 1958. It is now more than 60 years of development. We hope that in the future, the hospital will continue to play an important role. The hospital has a fairly strong capacity of treatment, and it has 1,600 beds. It is capable of dealing with large number of cases and patients. So in the future, together with Ditan Hospital, Yuan Hospital, and the 5th Medical Center of the General Hospital of the Liberation Army, these hospitals will play very important roles in taking in the patients. We're also thinking about the regular roles and functions of the Xiaotangshan Hospital in the light of its strengths in the future. Previously, it was quite good at health management and rehabilitation. Yet in the future, topped on these previous functions, the Xiaotangshan Hospital is also expected and designed to play a more important role in taking in and treating the infectious disease patients. Also, we are considering to strengthen the hospital with the testing capacity. We are planning to build a large laboratory there, and it can play an even more important role in the future. Okay. On the left, on the second row, the reporter in white, please. Thank you. With Beijing Broadcasting and the TV station, in the fight against COVID-19, hospitals are treating the patients while the communities are preventing the transmission. For the achievement of the communities, we can hardly use the number of patients cured or treated. Then how about the specific roles played by the communities in this fight against the COVID-19? We will have Madam Han Zhenzhen to take your question. Thank you very much for your question and your interest in the community-based healthcare centers. Indeed, our paramount responsibility is to have early screening and initial screening for those suspected cases with symptoms like fever, respiratory syndromes, and the exposure history. We are to identify them and use the ambulance to transfer these suspected cases to the designated hospitals. We call them triage and screening. It looks seemingly easy, yet it is extremely important. Suppose our medical professionals had not been careful enough and had some misdiagnosis or understatement, then this may cause the spread of the transmission, especially among the medical professionals, the close contacts, and the family members of the suspected cases. the fallout would be disastrous. Now, over 3 months have passed. In every community healthcare center, this is the task that we constantly do. We work 24/7 or 7/24 and ensured that the patient safety, the zero infection among the medical professionals. So this is the first task we are conducting. The second task is to have the home-based medical observation for the close contacts and family members of the suspected or the confirmed cases. So every day we had 2 times of telephone communication asking about the body temperature, the symptom development, and also the psychological conditions of the particular person. Also, we conducted health education as well as counseling to these people. That means within the 14 days of quarantine period, all the health problems or questions are answered or are taken care by the GPs at the community level. If the person develops symptoms like fever and other COVID-19 related symptoms, the GPs will call the ambulance and transfer the person to the designated hospital. And if the person needs the NCD drugs against hyper blood pressure, hypertension, the diabetes, and etc., the GP should prescribe the medicines and send them to the patient. And if this particular person has some psychological concerns or problems, psychological counseling will also be provided by the GP. And after the end of the 14-day quarantine, if nothing happens, and the GP is also expected to provide the quarantine certificate. So that means in the whole process of the 14-day quarantine, the community healthcare center, as well as the GPs working in the community healthcare center, are to manage everything related with the person. So this is the second task. The third task for us is health education. We've been divided based on the specific locations. For instance, in our community, it can be further divided into 12 sub-communities. They are schools, neighborhood residences, and etc. During the epidemic, we need to provide health knowledge to all these people. We came up with the idea that if we can record the health knowledge or tips into video clips, and then with the help of the community staff or community workers, we can send these video clips to the households in order to achieve the health knowledge promotion objectives. That's why we call on all the CPC party members, the Youth League members, as well as officials in the community to record 21 video clips. Each video clip is short. It only lasts 2 minutes, but these video clips cover every aspect of the daily lives of the residents. So they become very good health education materials. Furthermore, today, the students in grade 9 and grade 12 are back to school, and companies have already restarted their work and production. So the community healthcare centers are also helping them to get ready for the resumption of work.
Thank you. Next question goes to the journalist on the second row on the right side. Thank you. With the Hong Kong Economic Herald, based on the information disclosure in Beijing, COVID-19 patients in Beijing have been hospitalized for a longer period. What were the features of treatment? I'd like to ask President Liang of Ditan Hospital to take the question. Thank you for your question. As a member and a doctor of ICU, starting from the first case in Beijing till today, I have been working along with my colleagues and I participated in the treatment. I can summarize the features of treatment in Beijing in 3 points. First, our past experiences have served a lot. In 2003, we encountered SARS. In the process of SARS compared, Beijing Municipal Health Commission paid great attention to the system development, which facilitated Ditan Hospital, Yuan Hospital, Xiaotangshan Hospital's development. Upon the arrival of this unexpected outbreak, we felt keenly it would be a very complicated battle. That was our consensus. We had a zoned and hierarchy approach. We set up a daily expert appraisal system and a consultation system for severe cases. We've selected the best health workers to support Ditan Hospital and Yuan Hospital and Xiaotangshan Hospital, these designated hospitals, to ensure the success of the treatment for severe and critical cases. In Ditan Hospital, under the deployment of the upper-level competent authority, 14 backbone nurses from ICU came to help us. All the ICU experts across the city, 10 of them have been supporting Yuan Hospital. Second, in this fight against COVID-19, we focused on the treatment of severe and critical cases. ICU wards were formed in such a way that there will be one most experienced doctor, which is at the professor level, and this doctor has to be in the ward 24 hours on 2 shifts, and once there is any emergency, they will respond immediately. Across the city, we've set up the experts panel with the elite experts on the panel. On a daily basis, we have a consultation in a video conferencing way. The doctor in charge at 3 o'clock in the afternoon will report in this consultation the progress of the disease and the treatment progress to ensure that we are at the best level of treatment. On a daily basis, we conduct 2 or more system appraisal and evaluation to select the severe cases and transfer them to ICU wards to take treatment necessary. So, on a daily basis, we have the consultation for the treatment of the most severe and critical cases. Like in the morning, I will report to my boss, Director Li Haichao, to share with the progress, and because they will help me coordinate health resources if we need it. It was indeed multidisciplinary participation by multiple hospitals to bring out the synergy. Third observation for me was that we've been following a super standardized process. In the treatment, we felt individual cases were very different with very different underlying diseases. So one strategy for one individual case, we must refine the treatment and carry out personalized treatment. And there are several subpoints. First, we've been combining Western and traditional Chinese medicine, give holistic consideration to the overall situation of individual patient, prudently prudently use the antiviral drugs, being it in D10 or UN hospital. Satisfaction rate was above 90%. Across Beijing designated hospitals, 92% of the patients have received a combination of TCM and Western medicines. Second, we have stricter control of the steroid usage. Only with the shock patients, they can use the steroid glucose treatment, also at a lower dosage to ensure safety. Third, we appropriately use the antibiotics and antivirals because we are dealing with the virus, so we cannot use antibiotics blindly. Only when there is obvious secondary infection with a known pathogen or microbial, we can use the antibiotic. Otherwise, we cannot use antibiotic empirically. Third subpoint is that the proper use of respiratory support. We have the high throughput nasal inhalation